Hello everyone and welcome. Today we are going to do a really deep dive into a powerful tool in our pain management toolbox, transdermal buprenorphine. This entire explainer is a tribute to the fantastic work of Dr. Ricardo Ferreira, and we're going to get right into the science that makes this molecule so incredibly special.
All right, so here's our game plan. We'll start by talking about the huge challenge of pain management itself. Then we'll look at opioids and why they're such a double-edged sword. After that, we'll unpack the unique science of buprenorphine, understand what makes it safer, see where it fits in the clinic, and wrap up by looking at it as a real bridge to rehabilitation for our patients.
So first things first, before we talk about solutions, let's get on the same page about the problem we're all trying to solve every single day, the complex, often overwhelming reality of pain.
Now, we've all seen the official IASB definition, right? But it is so worth reading it again. It reminds us that pain is never, ever just a physical thing. It's a sensory and emotional experience. That emotional piece is crucial, and it's exactly what makes treating pain so darn difficult.
And you know, this isn't some abstract concept. It's a massive public health crisis. Just look at this map of Brazil. Every single one of those dots represents a community filled with real people, thousands of them, living with chronic pain and just desperate for some relief.
To put a number on it, some studies in Brazil show the prevalence of chronic pain hitting as high as 47%. Think about that for a second. Almost half the people in some areas. A number like that really drives home our responsibility to find better and especially safer ways to help.
Okay, so that brings us to our most powerful weapon against severe pain, opioids. They are absolutely essential, but man, they come with a serious price tag. Let's get into that paradox. For decades, this has been our guide, right? The WHO analgesic ladder. It's the foundation of how we think about pain treatment. And it makes perfect sense. You save the strong opioids for the top of the ladder, for moderate to severe pain when nothing else is cutting it.
But here's the catch. Here's the reality on the ground. As powerful as they are, up to a third of our patients just can't get relief with traditional opioids. And it's not because the drugs don't work, it's because the side effects become so unbearable that we can't get the dose high enough to actually control their pain. And when you look at the data side by side, it becomes crystal clear. Your classic opioids like morphine and fentanyl, while they bring along a heavy burden of really difficult side effects, constipation, sedation, and the one that really scares us, respiratory distress. So, this all leads us to the million-dollar question, doesn't it? Do we have to accept this trade-off? Is there a way to get that powerful, life-changing pain relief without all the dangerous side effects that can harm our patients and derail their treatment? And that very question is what leads us to buprenorphine. This molecule offers a completely different answer. So let's geek out a little bit and look at the basic science that makes it tick.
Okay, so buprenorphine is not your average opioid. First off, it's about 30 times more potent than morphine. It's also super lipophilic, meaning it gets into tissues really well. But, and this is the most important part, it has this totally unique receptor profile. It's a partial agonist at the mu receptor, that's where we get analgesia, but an antagonist at the kappa and delta receptors.
This complex action is what makes it so elegant. Buprenorphine gives us that powerful, long-lasting pain relief by partially hitting the mu receptor. But at the same time, it's blocking the kappa and delta receptors, which are the ones often tied to nasty side effects like dysphoria and constipation. It's a much more targeted approach.
So, let's connect those two ideas. How does this unique pharmacology, the special way it works, actually make it safer for our patients in the real world?
While unlike a full agonist like fentanyl, which just slams the mu-opioid receptor and turns on every single pathway, buprenorphine is more selective. It's a partial agonist. It gives you the signal you need for strong pain relief without fully lighting up all those other pathways that lead to the worst side effects.
And this leads to what is, without a doubt, the most critical safety feature of this drug, the ceiling effect for respiratory depression. I mean, look at this graph. With traditional opioids, the higher the dose, the higher the risk of someone stopping breathing. The line just keeps going up. But with buprenorphine, that risk flattens out. It hits a ceiling. That is a profound built-in safety margin. That is a total game changer.
So let's take all this cool science from the lab and bring it to the bedside. How does this actually change the way we care for patients, especially when we can deliver it through a patch? The transdermal patch system is just brilliant. It delivers a steady, constant level of medication for 7 straight days. No more peaks and valleys, which means no more of that awful end-of-dose pain.
Plus, it bypasses the liver, and of course, it's perfect for anyone who struggles to swallow pills. It just makes everything so much simpler.
Now, you put that pharmacology and that delivery system together, and what you get is an amazing option for our most fragile patients. We're talking about the elderly, maybe someone with a painful vertebral fracture from osteoporosis, or patients with kidney problems, even those on dialysis, and people with lots of other health issues. For them, this safety profile is a huge win.
And the clinical trials back this up completely. When you put it head-to-head against oral morphine, transdermal buprenorphine has way less nausea, vomiting, and constipation. But look at this last line, the discontinuation rate. Patients are so much more likely to actually stay on buprenorphine simply because they can tolerate it better. That's huge for treatment success. But at the end of the day, our job isn't just to make the pain number go down. As the great pioneers like Professor Bonica taught us, the real goal is to restore function. It's to give our patients their lives back. This quote says it all. This is the heart of modern multimodal pain care. We're using these advanced, well-tolerated tools not as the end of the road, but as a therapeutic bridge. A bridge to get the patient over the chasm of debilitating pain so they can start the real work of getting better.
Just think about it. By giving someone stable, effective pain relief, you're opening up this critical window of opportunity. That patient with an acute fracture, they can now actually do their physical therapy. The person with chronic pain, they finally have enough relief to start making those massive lifestyle changes they need to make. We're controlling the pain so that rehabilitation can finally begin.
So this really invites us to think differently, doesn't it? With safer, more effective tools like this in our arsenal, pain management is no longer just about making someone comfortable. We can actually transform pain treatment from being an endpoint into being the very first step of a brand new beginning for our patients.